As COVID-19 coronavirus infection continues to spread around the country, data has shown that minorities are often disproportionately impacted by infection and death. A variety of underlying factors related to social inequalities are driving these disparities. Looking at hospitalizations for COVID-19 and taking into account age, data from the CDC shows that people who are Black, Hispanic, and Latino, and Native American/Alaskan Natives have 4 to 5 times the rate of hospitalizations compared to white people. Deaths reflect a similar trend. For example, only 13% of the United States population is Black, but 23% of reported COVID-19 deaths have occurred among the African American population. In Georgia, for example, Black Americans represent 32% of the state's population, but account for roughly 47% of COVID-19 deaths. Looking at county comparisons on the COVID-19 Health Equity Dashboard, we can find some clear visual representations of these statistics across a wide variety of states with different geographies, population density, and demographic characteristics. To start visualizing, click on the tab Map Your State. By selecting a state and next selecting deaths under COVID outcomes and finally selecting percent African American in county population characteristics, you can map side by side these relationships in a state of your choosing. As we see here, deaths per 100,000 in New York track with the African American population. Then here is Alabama. Next, by selecting a state and selecting cases instead of deaths under COVID outcomes and selecting percent African American in county population characteristics, you can map side by side these relationships in another state of your choosing. As we see here, cases per 100,000 in Kentucky track with the African American population. Then here is Louisiana, Missouri, and Ohio. Take a look for yourself at these maps and see the relationships you can visualize between COVID-19 and county characteristics.